Ciaran Martin was head of cybersecurity at GCHQ, the UK's leading signals intelligence agency, and founded the National Cyber Security Centre there. He's now on the global advisory board of CyberCX. The company is a strategic advisor to Medibank. He joins me now from Canberra. Ciaran Martin, welcome to 7:30.
Thanks for having me on, Sarah.
Now, the Prime Minister, Anthony Albanese, praised Medibank for not paying a ransom to the hackers. That may be a hard message for some victims to hear, especially today. Is it a good decision?
I think it makes sense. I think it's in our collective interest that ransoms aren't paid because we all know that incentivises further attacks. Having said that, ransoms do get paid in cyber attacks because sometimes victim organisations feel they have no choice. But details matter in these horrible incidents, and it is, as Minister O'Neill said, these are the lowest of the low. But what are they demanding? In some cyber hacks, what happens is the hackers lock you out of a network, so the network doesn't work. So in a healthcare system, appointments get cancelled and so forth. And what you pay for is what's called a decryptor key. And they say, we will give you a key to let you back into the network. And horrible though that sounds, sometimes it works, and therefore the organisation feel it makes sense to pay. In this case, and lots of other cases, it's different. They're saying, we've copied some of your data illicitly, and we're going to release it if you don't pay us. But if you pay, you don't get the data back. They might tell you that they're returning the data to you, but there's no way you can guarantee that you can be assured that they're not going to come back in a month or a year and say, well, we've still got it and pay us again. And some research by commercial cybersecurity companies has said that in up to 1 in 5 cases that they can verify, people who've paid get done again. So even if you take the sort of ethics and morality out of it and the moral hazard out of it, you can't really buy your way out of this problem, sadly.
Now, the situation is that the Home Affairs Minister said today that this could go on for weeks, indeed for months. Now, assuming that there's no change of Medibank's tactics during that period, what happens next?
Well, even if there is a change of tactics, these things still, unfortunately, can drag on. It's not particularly helpful to speculate on what might happen in this specific case because we don't know. But if you look at cases like this in the past, then over time what you find is, firstly, there is one bit of this where I think it's important not to exaggerate the potential for harm. So there was a very serious case in the Republic of Ireland about 18 months ago where the entire national healthcare system was hacked, and there was a threat of a data dump of every Irish citizen's medical records. Now, when the Irish government looked at this, because it was a state-run body, they chose not to pay because actually no one's going to host on the open internet, no one's going to host a searchable database of people's health records where you can look up your neighbour or a celebrity or whatever, and if somebody did host it, it would get taken down pretty quickly. So this is on the deliberately hidden web that is harder to access. So what is the criminal intent? If they can't extort, as in this case they can't, then maybe they'll try to extort individuals, maybe they'll try to sell it to other criminals. But of course, as you heard from the AFP, law enforcement will be after this type of activity. So you expect in these sorts of cases, you expect a sort of an attritional battle, if you like, between these criminals who you can't trust and the authorities. And let's hope and expect that some of the excellent capabilities of the Australian government, these excellent partners in the ACSC and in the federal police, can actually bring about some reduction in the threat here. And let's not assume that there will be a mass data dump of easily searchable material, because there are things we can try to do to reduce the risk of that happening.
There is a huge amount of our medical data now online, obviously made clear in this case, or also moving online in Australia and in other countries. Should we trust the systems in place to protect it, given how sensitive it is?
Well, I think this is a serious wake-up call in that respect. And I think, it is easy to take the view that when very serious incidents like this happen, that we should lock down all sorts of data. But of course, as you see in things like the research that produces the world-saving, the life-saving, world-changing COVID vaccines, you do need data sets of individual health records and so forth to do the sorts of research and development and do the provision of healthcare on which we all depend. So it's about striking it's about striking a balance. I do think that there are cases, as the Minister has said, some of the cyber criminals do stay away from healthcare, but the lowest of the low don't. And I think we need to get better at how we assess essentially the value of data. So sometimes you hear of data breaches and you might hear that it's 100 million records have been stolen, but actually there's very little in these records. Just names, maybe an email address and the last 4 digits of a bank card number. There's not a great deal you can do with that. In healthcare records, there is a case for making sure that much greater protections are in place that we require, perhaps by law or by some other mechanism. We require higher standards, that we segregate, for example, the routine payment data from sensitive medical records and so forth. And we basically get better at working out what data is really valuable and really sensitive and matters most to us, and therefore apply greater protections to that bit, because it's not economically efficient to apply really state-of-the-art data protections to all pieces of data. There's just too much of it to do that sensibly and economically. But there are parts of this which will be very sensitive, and that's a discussion we should have. That's
in a sense in the future, and an important discussion to have. Today, the Federal Police says that Australia needs to be a less permissive environment. Does that mean that Australia is particularly vulnerable to this sort of attack?
So I think the evidence isn't there to say that Australia is more vulnerable than, say, the United Kingdom, which I know very well. These things have a habit of coming in waves. If we'd been having this conversation a year ago, actually the Australian data breach and wider cyber harms picture was relatively quiet, whereas Western Europe and North America was on fire, and now at the moment it's the other way around. So you can't draw these sweeping conclusions. However, Australia is, by global standards, a prosperous country. It's a highly digitized country, and it speaks English, and a lot of these criminals have English as a second language, if not a first language. So like the United Kingdom, like the United States, like Canada, it can be an attractive target for cyber criminals. So I don't think Australia is uniquely bad at cyber security. As the Minister said, there are plenty of improvements that will need to be made, but it's an attractive target because it's wealthy, it's highly digitised, and it speaks English.
Ciaran Martin, thank you very much for sharing your expertise with us this evening.
Thank you.